So thank you very much. I'm Dr. Peter Chiu from the Chinese University of Hong Kong. So I'm glad to have this interview today. I would like to highlight one of the abstracts that I present this time. It is the SMART trial, which is a randomized controlled trial comparing, just like in the precision trial, comparing the MRI first arm and then followed by biopsy only if there is MRI lesion versus a transperineal systematic extended biopsy arm. And we're comparing that just like in the precision trial. Now, in the past, precision trial tells us that transrectal systematic biopsy was inferior actually to MRI-guided approach. But now in our trial, we show that actually MRI first is actually equivalent significant cancer detection compared with a transperineal systematic extended biopsy. Now, but the message is we still want to go for MRI first because MRI could actually reduce 44% of the unnecessary prostate biopsies, which is a good news for the patient. But when MRI is not readily available in a short time, I think a transperineal systematic biopsy is a good alternative. So that is the message of our study. So it's very important that the mHSPC treatment paradigm has changed a lot in the past 5 years. In the past, we only give androgen deprivation therapy, ADT, alone. But now, maybe 5 to 10 years, we're actually giving a combination treatment like doublet treatment or triplet treatment. So in a study, we're very proud that the Chinese University of Hong Kong is actually the first site outside Europe to join this pioneer big data for prostate cancer, which is the world's biggest database for advanced prostate cancer. And some of the initial findings include that for mHSPC, to this date, there are more than 40%, up to 50% of the people, even in Europe, in US, or in other places in the world, in Asia, is having only ADT as a single treatment agent. But in the current recommendation, doublet or even triplet should be the standard. So there's so much work that needs to be done, but the data provides a lot of insight into what we could do more for our patients. So in our center, we have actually also developed a novel system in using AI assistance to automatically diagnose prostate cancer on an MRI prostate. So just by putting in the films into the software, we could actually know where the prostate is, where the tumor is, and that actually is in terms of the accuracy, is similar to the radiologist's interpretation. And it helps us to not only diagnose on the MRI, it also helps us to target our prostate biopsy. And this, I think, will be the future. So the AI-guided assistance in radiology or MRI prostate reporting, I believe will be more and more common and will be used in every hospital in the future.